Question 1. Regulatory review indicates that a competent adult patient has clearly refused a recommended medical intervention, stating they understand the risks and benefits. However, the patient's adult children are present and strongly urge the nurse to proceed with the intervention, believing it is in their parents' best interest. Which of the following actions best upholds the principles of patient autonomy and informed consent within the scope of licensed practical nurse practice? Option A. Administer the intervention as requested by the family, assuming the patient's refusal was due to temporary emotional distress. Option B. Gently explain to the family that the patient's decision is final and that their input cannot override their parents' autonomy without further engagement. Option C. Ensure the patient's refusal is documented. Inform the healthcare provider of the patient's decision and the family's concerns, and advocate for the patient's right to make their own healthcare choices. Option D. Proceed with the intervention as the family is insistent and appears more knowledgeable about the patient's long-term well-being. Correct answer is C. Ensure the patient's refusal is documented, inform the healthcare provider of the patient's decision and the family's concerns, and advocate for the patient's right to make their own healthcare choices. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a patient's stated wishes and the perceived best interests of their family. The licensed practical nurse, LPN, must navigate the delicate balance of respecting patient autonomy while also acknowledging the family's involvement and potential concerns, all within the bounds of regulatory and ethical practice. The LPN's role is to advocate for the patient's rights and ensure their wishes are honored, even when faced with external pressure. Correct approach analysis. The correct approach prioritizes the patient's right to self-determination, which is a cornerstone of informed consent and patient autonomy. Regulations governing LPN practice, such as those found in state nurse practice acts and ethical codes like the American Nurses Association, ANA, Code of Ethics, mandate that patients have the right to make decisions about their own health care, including the right to refuse treatment, provided they have the capacity to do so. The LPN's responsibility is to ensure the patient has received adequate information to make an informed decision and that their choice is respected. This aligns with the principle of beneficence, acting in the patient's best interest, which includes respecting their autonomy and non-maleficence, avoiding harm, which can occur if a patient's wishes are overridden. Incorrect approaches analysis. One incorrect approach involves overriding the patient's decision based on family pressure. This directly violates the principle of patient autonomy and the legal right to informed consent. It constitutes a failure to uphold the patient's right to self-determination and could lead to legal repercussions for the nurse and the healthcare facility. Ethically, it breaches the duty of loyalty to the patient. Another incorrect approach is to proceed with the treatment without further discussion, assuming the patient's initial refusal was a temporary emotional reaction. This fails to ensure the patient has truly understood the implications of their decision and has had the opportunity to ask questions or reconsider. Informed consent is an ongoing process, not a one-time event, and requires clear communication and confirmation of understanding. A third incorrect approach is to dismiss the family's concerns entirely without attempting to understand their perspective or involve them appropriately. While the patient's autonomy is paramount, a compassionate approach often involves facilitating communication between the patient and family with the patient's permission to address concerns and promote understanding. However, this facilitation must never supersede the patient's ultimate decision-making authority. Professional reasoning. When faced with such a situation, a professional LPN should first assess the patient's capacity to make decisions. If the patient has capacity, the LPN should ensure the patient has received all necessary information about the proposed treatment, its benefits, risks, and alternatives, and that they understand this information. The LPN should then clearly communicate the patient's decision to the healthcare provider and document it accurately. If family members are present and have concerns, the LPN, with the patient's consent, can facilitate a conversation between the patient and family, or involve the healthcare provider to address the family's questions, always reinforcing that the final decision rests with the patient. The LPN's primary role is to advocate for the patient's expressed wishes and ensure their rights are protected. Question 2. The evaluation methodology shows that a licensed practical nurse is caring for an elderly patient recovering from surgery. The patient expresses a desire to groom themselves before visitors arrive, stating, "I want to feel like myself again, not just a patient." The LPN is concerned about the patient's mobility and the time constraints of the shift. How should the LPN best address the patient's esteem needs in this situation? Option A. Offer to assist the patient with grooming, explaining that it will be done efficiently and respectfully, while also asking if there are specific aspects they would like to manage themselves. Option B. Allow the patient to attempt grooming independently without offering any assistance, trusting that they will manage despite potential difficulties, to fully respect their desire for autonomy. Option C. Proceed with grooming the patient as quickly as possible to ensure they are ready for visitors, assuming the patient's request is a minor concern compared to the need for timely preparation. Option D. Gently explain to the patient that, due to their current mobility limitations and the busy schedule, it would be best for the nurse to handle their grooming today to ensure everything is done correctly and on time. The correct answer is A. Offer to assist the patient with grooming, explaining that it will be done efficiently and respectfully, while also asking if there are specific aspects they would like to manage themselves. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed practical nurse, LPN, to assess and respond to a patient's psychological and social needs, specifically their esteem needs, within the context of a potentially sensitive and personal situation. The LPN must balance the patient's desire for autonomy and respect with the need for appropriate care and safety, all while adhering to professional standards and ethical obligations. The risk lies in misinterpreting the patient's cues, leading to either an overly intrusive intervention that damages trust or an insufficient response that neglects a crucial aspect of well-being. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient dignity and self-worth. It acknowledges that esteem needs, as described by Maslow's hierarchy, are fundamental to overall well-being and recovery. By offering the patient the opportunity to manage their personal grooming independently, the LPN respects their autonomy and reinforces their sense of self-efficacy and control. This aligns with the ethical principle of respecting patient autonomy and promoting their dignity, which are core tenets of nursing practice as outlined in professional nursing standards and state nurse practice acts. This approach fosters a therapeutic relationship built on trust and respect, which is essential for effective patient care. Incorrect approaches analysis. One incorrect approach fails by assuming the patient is incapable of self-care due to their condition, thereby infantilizing them and undermining their esteem. This disregards the patient's potential for independence and can lead to feelings of helplessness and decreased self-worth, violating the ethical duty to promote patient dignity and autonomy. It also fails to assess the patient's actual capabilities and preferences. Another incorrect approach overlooks the patient's expressed desire for privacy and independence, proceeding with care without explicit consent or offering alternatives. This constitutes a breach of patient autonomy and can be perceived as disrespectful, damaging the therapeutic alliance. It prioritizes task completion over the patient's psychological and emotional needs, which is contrary to holistic nursing care principles. A further incorrect approach dismisses the patient's request as a minor inconvenience or a sign of resistance, failing to recognize the significance of esteem needs in the patient's overall recovery and well-being. This demonstrates a lack of empathy and a failure to understand the psychological impact of illness and hospitalization, leading to a less than optimal patient experience and potentially hindering their engagement with care. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's physical, psychological, and social needs. This includes actively listening to the patient's verbal and nonverbal cues, understanding their preferences, and recognizing their right to self-determination. When addressing esteem needs, the LPN should consider how to support the patient's sense of self-worth and independence within the scope of their abilities and the care plan. This involves offering choices, respecting privacy, and providing opportunities for self-care whenever possible, always in alignment with professional ethical guidelines and regulatory requirements. Question 3. Governance review demonstrates that a licensed practical nurse is caring for an elderly patient who is refusing their prescribed nutritional supplement. The patient states they are not hungry and don't want that stuff. The nurse has assessed the patient's vital signs, which are stable, and the patient appears alert and oriented. What is the most appropriate initial nursing approach to address this situation, considering the patient's basic human needs? Option A. Engage the patient in a conversation to understand the reasons for their refusal and explore potential barriers to intake, while continuing to monitor their overall nutritional status. Option B. Assume the patient is being difficult and chart the refusal, focusing on other aspects of care for the shift. Option C. Document the patient's refusal and inform the physician immediately that the patient is not consuming their nutritional supplement. Option D. Gently but firmly insist that the patient consume the supplement, explaining that it is essential for their health and well-being. Correct answer is A. Engage the patient in a conversation to understand the reasons for their refusal and explore potential barriers to intake, while continuing to monitor their overall nutritional status. Explanation. Scenario analysis. This scenario presents a common challenge in practical nursing, where a patient's expressed desire conflicts with a perceived physiological need, requiring the nurse to balance patient autonomy with professional judgment regarding basic human needs. The challenge lies in assessing the underlying cause of the patient's refusal and ensuring their safety and well-being without infringing on their rights. Correct approach analysis. Prioritizing open communication and further assessment is the best professional practice. This aligns with the ethical principle of patient autonomy, which dictates that patients have the right to make decisions about their own care, provided they have the capacity to do so. It also adheres to the nursing standard of care, which mandates a thorough assessment to understand the root cause of a patient's behavior or refusal. By exploring the reasons behind the patient's refusal to eat, the nurse can identify potential barriers such as pain, nausea, depression, or misunderstanding, and then address these issues appropriately. This approach respects the patient's dignity and promotes a therapeutic relationship, ultimately leading to a more effective care plan that considers both physiological needs and individual preferences. Regulatory frameworks for licensed practical nurses emphasize patient-centered care and the importance of assessment and communication in developing individualized care plans. Incorrect approach is analysis. Forcing the patient to eat or administer nutritional supplements without understanding the reason for refusal disregards patient autonomy and can be considered a form of coercion, violating ethical principles and potentially regulatory guidelines that protect patient rights. This approach fails to address any underlying issues that might be causing the refusal, such as pain or psychological distress, and can damage the nurse-patient relationship. Assuming the patient is simply being difficult or uncooperative and documenting the refusal without further investigation is a failure in the nursing process. It neglects the professional responsibility to assess and intervene when a patient's basic human needs may be compromised. This can lead to malnutrition and other health complications, representing a breach of the standard of care and potentially violating regulations related to patient safety and quality of care. Immediately escalating the situation to a physician without attempting to gather more information or engage the patient directly bypasses the LPN's role in initial assessment and patient interaction. While physician consultation is important, it should follow a thorough LPN-led assessment, not replace it. This approach fails to utilize the LPN skills in direct patient care and communication, potentially leading to unnecessary medical interventions or a delay in addressing the patient's immediate concerns. Professional reasoning. When faced with a patient's refusal of a basic need like nutrition, a licensed practical nurse should employ a systematic decision-making process. This begins with a thorough assessment to understand the patient's perspective and identify any contributing factors. Open-ended questions, active listening, and observation are crucial. If the patient's refusal is based on a misunderstanding or a manageable symptom, e.g., nausea, the nurse should attempt to address these issues. If the patient demonstrates capacity and maintains their refusal, the nurse must respect their autonomy while continuing to monitor for any adverse effects and documenting the situation thoroughly. Collaboration with the healthcare team, including physicians and dietitians, is essential when the patient's refusal poses a significant risk to their health, but this collaboration should be informed by the LPN's initial assessment and patient engagement. Question 4. Implementation of accurate pulse assessment by a licensed practical nurse requires adherence to established protocols. Which of the following actions best demonstrates this adherence when assessing a patient's radial pulse? Option A. Asking a colleague to perform the pulse assessment if time is limited. Option B. Counting the pulse for a full 60 seconds, noting the rate, rhythm, and quality. Option C. Estimating the pulse by counting for 15 seconds and multiplying by 4. Option D. Relying on the patient's statement about their usual pulse rate. The correct answer is B, counting the pulse for a full 60 seconds, noting the rate, rhythm, and quality. Explanation: scenario analysis. This scenario is professionally challenging because accurately assessing a patient's pulse is a fundamental LPN skill, yet variations in patient condition, equipment, and environmental factors can influence the assessment. The LPN must exercise critical judgment to ensure the accuracy and reliability of the data collected, as it directly impacts patient care decisions and communication with the healthcare team. Correct approach analysis. The correct approach involves consistently applying the established nursing process and adhering to facility policy and State Nurse Practice Act guidelines for vital sign assessment. This includes proper hand hygiene, patient identification, selecting the appropriate site for pulse assessment, e.g., radial, apical, using a timepiece with a second hand or digital display, counting for a full minute, and noting rate, rhythm, and quality. This systematic method ensures the collection of accurate, objective data, which is essential for safe and effective patient care, and aligns with the LPN scope of practice as defined by regulatory bodies. It also facilitates clear and precise communication with the registered nurse and other healthcare providers. Incorrect approaches analysis. One incorrect approach would be to estimate the pulse rate by counting for only 15 or 30 seconds and multiplying. This is a failure to adhere to best practice guidelines and potentially the facility's policy, which typically mandates a full minute count for accuracy, especially in patients with irregular rhythms. This shortcut can lead to inaccurate data, potentially masking significant changes in the patient's condition, and violates the ethical principle of beneficence by not ensuring the highest quality of care. Another incorrect approach would be to rely solely on the patient's subjective report of their pulse rate without independent verification. While patient input is valuable, the LPN has a professional responsibility to objectively assess vital signs. This approach neglects the LPN's duty to perform a direct assessment and could lead to misdiagnosis or delayed intervention if the patient's perception is inaccurate, violating the principle of non-maleficence. A third incorrect approach would be to delegate the pulse assessment to an unlicensed assistive personnel, UAP, without proper training, supervision, or verification of the UAP's competency, or if the patient's condition warrants direct LPN assessment as per facility policy or professional judgment. While UAPs can assist with vital signs, the ultimate responsibility for accurate assessment and interpretation often rests with the licensed nurse, especially in complex or unstable situations. This could be a violation of the Nurse Practice Act regarding delegation and scope of practice for UAPs, and a failure of the LPN to maintain accountability for patient care. Professional reasoning. When assessing a patient's pulse, the LPN should follow a structured decision-making process. 1. Review the patient's chart for baseline vital signs and any specific conditions that might affect pulse assessment, e.g., arrhythmias, pacemakers. 2. Gather necessary equipment, watch with a second-hand pen, paper. 3. Perform hand hygiene and identify the patient. 4. Select the appropriate site for pulse assessment, considering the patient's condition and facility protocol. 5. Apply proper technique for palpating the pulse. 6. Count the pulse for a full minute, noting rate, rhythm, and quality. 7. Document findings accurately and report any significant deviations from baseline or expected values to the registered nurse or physician. 8. If any aspect of the assessment is unclear or the patient's condition is unstable, seek assistance or clarification from a registered nurse. Question 5. Market research demonstrates that effective communication is a cornerstone of quality patient care, particularly when addressing diverse patient populations. A licensed practical nurse is caring for a patient whose primary language is not English and who expresses a preference for traditional healing practices alongside Western medicine. The nurse needs to discuss the patient's medication regimen and potential side effects. Which of the following approaches best reflects culturally competent communication and professional practice? Option A. The nurse proceeds with explaining the medication regimen and side effects in English, assuming the patient will understand or can look up the information later, and politely dismisses the mention of traditional healing practices as outside the scope of Western medical care. Option B. The nurse utilizes a qualified medical interpreter to explain the medication regimen and side effects, and respectfully inquires about the patient's traditional healing practices, asking how they might be integrated or managed alongside the prescribed medications, ensuring the patient understands the rationale for both. Option C. The nurse explains the medication regimen and side effects using medical jargon, assuming the patient's familiarity with healthcare terminology, and expresses concern that traditional healing practices are unscientific and potentially harmful, discouraging their use. Option D. The nurse relies on gestures and simple English phrases to convey information about the medication, believing that visual cues are universally understood, and advises the patient to discontinue any traditional healing practices that might interfere with the prescribed treatment. The correct answer is B. The nurse utilizes a qualified medical interpreter to explain the medication regimen and side effects, and respectfully inquires about the patient's traditional healing practices, asking how they might be integrated or managed alongside the prescribed medications, ensuring the patient understands the rationale for both. Explanation. This scenario is professionally challenging because effective communication is fundamental to patient care, and cultural differences can create significant barriers to understanding, trust, and adherence to treatment plans. A licensed practical nurse, LPN, must navigate these differences with sensitivity and skill to ensure safe and equitable care. Careful judgment is required to avoid misinterpretations, offense, and potential harm. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to the ethical and regulatory standards governing nursing practice. Specifically, it aligns with the principles of patient advocacy, respect for diversity, and the legal requirement to provide care that is free from discrimination. By actively seeking to understand the patient's cultural context and preferences, the LPN demonstrates cultural competence, which is essential for building rapport, gathering accurate health information, and developing an effective care plan. This approach upholds the nursing code of ethics and any relevant state or federal regulations mandating culturally sensitive care. An incorrect approach that relies on assumptions or stereotypes is professionally unacceptable. This failure constitutes a violation of ethical principles by demonstrating a lack of respect for the patient's individuality and cultural background. It can lead to misdiagnosis, non-compliance with treatment, and erosion of the patient-provider relationship. Furthermore, such an approach may contravene state nursing practice acts or federal regulations that require healthcare providers to offer culturally and linguistically appropriate services, potentially leading to disciplinary action. Another incorrect approach that dismisses the patient's cultural concerns as unimportant or irrelevant is also professionally unacceptable. This demonstrates a lack of empathy and cultural humility, failing to recognize the profound impact of culture on health beliefs and practices. Ethically, it violates the duty to treat patients with dignity and respect. Legally, it could be seen as a form of discrimination if it results in substandard care due to cultural insensitivity. The professional reasoning process for similar situations should involve a commitment to lifelong learning in cultural competence. When encountering a patient from a different cultural background, the LPN should 1. Acknowledge their own potential biases and assumptions. 2. Actively listen to the patient and their family, seeking to understand their perspectives, beliefs, and values related to health and illness. 3. Utilize available resources, such as qualified interpreters or cultural liaisons, when language or cultural barriers exist. 4. Adapt communication strategies and care plans to be congruent with the patient's cultural preferences, whenever safe and feasible. 5. Document communication and any cultural considerations that influenced care. Question 6. Stakeholder feedback indicates that a significant number of patients at the facility are experiencing communication difficulties due to language barriers, leading to concerns about patient understanding of care instructions and medication regimens. As a licensed practical nurse, you are caring for a patient who speaks very little English and appears to be struggling to understand your explanations about their upcoming procedure. What is the most appropriate action to take to ensure effective communication and patient comprehension? Option A. Document the communication difficulty and proceed with the procedure, noting that the patient's understanding is limited. Option B. Ask the patient's visiting adult child to translate the procedure details, as they seem to be familiar with the patient's needs. Option C. Request a qualified medical interpreter to facilitate the communication and ensure accurate understanding of the procedure. Option D. Proceed with explaining the procedure using simple English and gestures, assuming the patient will grasp the essential information. The correct answer is D. Proceed with explaining the procedure using simple English and gestures, assuming the patient will grasp the essential information. Explanation. This scenario presents a common implementation challenge in healthcare settings, overcoming barriers to effective communication. The professional challenge lies in balancing the need for clear, concise, and timely information exchange with the diverse needs and backgrounds of patients and healthcare team members. Effective communication is paramount for patient safety, quality of care, and adherence to regulatory standards, as mandated by nursing practice acts and facility policies. The correct approach prioritizes patient-centered care and adherence to professional nursing standards. It involves actively seeking to understand the patient's preferred communication method and ensuring that information is conveyed in a manner that the patient can comprehend. This aligns with ethical principles of beneficence and autonomy and regulatory requirements for informed consent and patient rights. By employing a qualified interpreter, the licensed practical nurse, LPN, demonstrates a commitment to overcoming language barriers, ensuring accurate information exchange, and respecting the patient's cultural background. This proactive measure directly addresses a significant barrier to effective communication, promoting patient safety and satisfaction. An incorrect approach would be to assume the patient understands English sufficiently or to rely on a family member who may not be a qualified interpreter. Assuming comprehension without verification can lead to misunderstandings, medication errors, and compromised treatment plans, violating the LPN's duty of care and potentially breaching regulatory requirements for clear patient education. Relying on an unqualified interpreter, such as a family member, poses risks of misinterpretation, omission of critical information, or the introduction of personal biases, all of which undermine the accuracy and effectiveness of communication and patient care. Furthermore, failing to address the language barrier directly and instead proceeding with care without ensuring comprehension could be seen as a failure to uphold patient rights and safety standards. Professional decision-making in such situations requires a systematic approach. First, identify the communication barrier. Second, assess the potential impact of the barrier on patient safety and care. Third, consult available resources such as facility policies, professional guidelines, and colleagues to determine the most appropriate intervention. Fourth, implement the chosen intervention, ensuring it is patient-centered and adheres to regulatory and ethical standards. Finally, evaluate the effectiveness of the intervention and make adjustments as needed. This iterative process ensures that communication barriers are proactively addressed, leading to optimal patient outcomes. Question 7. The control framework reveals that a licensed practical nurse is monitoring a post-operative patient who has a baseline temperature of 98.6 degrees F. The LPN observes the patient's temperature reading to be 99.8 degrees F. The patient is alert, oriented, and denies any discomfort. What is the most appropriate course of action for the LPN? Option A. Administer an antipyretic medication to lower the temperature, as per protocol for any temperature above 99 degrees F. Option B. Document the temperature and continue to monitor the patient, as this slight elevation is within acceptable parameters for a post-operative patient and the patient is asymptomatic. Option C. Immediately notify the registered nurse and physician of the temperature elevation, as any increase from baseline requires urgent reporting. Option D. Record the temperature as 98.6 degrees F to maintain consistency with the patient's baseline and avoid unnecessary alarm. The correct answer is B. Document the temperature and continue to monitor the patient, as this slight elevation is within acceptable parameters for a post-operative patient and the patient is asymptomatic. Explanation. This scenario is professionally challenging because it requires a licensed practical nurse, LPN, to interpret subtle changes in a patient's vital signs and correlate them with the patient's overall condition, rather than just passively recording numbers. The LPN must exercise clinical judgment to determine when a deviation from baseline is significant enough to warrant intervention or escalation. This requires a deep understanding of normal physiological parameters, potential pathological processes, and the specific patient's history and current status. The correct approach represents best professional practice because it prioritizes patient safety and timely intervention, accurately assessing and reporting vital signs, recognizing deviations from the patient's baseline, and communicating these findings promptly to the registered nurse or physician aligns with the LPN scope of practice as defined by the specified jurisdiction's Nursing Practice Act/regulations, e.g., Nurse Practice Act of Texas, or relevant state board of nursing regulations. This proactive approach ensures that potential complications are identified early, allowing for prompt diagnosis and treatment, thereby preventing adverse outcomes. Ethically, this demonstrates adherence to the principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. An incorrect approach of simply recording vital signs without considering their significance or the patient's presentation would be a failure to exercise professional judgment and could violate the LPN's duty of care. This could lead to delayed recognition of a deteriorating patient condition, potentially resulting in harm, which would be a breach of the jurisdiction's Nursing Practice Act/regulations and ethical standards. Another incorrect approach, such as overreacting to minor fluctuations without considering the patient's overall stability, could lead to unnecessary interventions, patient anxiety, and inefficient use of healthcare resources, also falling short of professional standards. Failing to communicate significant findings to the appropriate healthcare provider is a direct violation of the LPN's responsibility to collaborate within the healthcare team and can have serious consequences for patient care, contravening jurisdiction's Nursing Practice Act/regulations regarding reporting and communication. Professionals should use a decision-making framework that involves 1. Accurate data collection, vital signs. 2. Interpretation of data in the context of the patient's baseline, medical history, and current condition. 3. Identification of significant deviations or trends. 4. Application of critical thinking to determine the potential cause and implications of these deviations. 5. Timely and appropriate communication with the registered nurse or physician. 6. Implementation of interventions as directed and evaluation of their effectiveness. Question 8. Investigation of a licensed practical nurse's response to a patient who states, "I'm so scared I can't sleep. Can you make sure my door is locked and then bring me a magazine? I'm bored." The LPN observes the patient appears restless and is looking around the room frequently. Option A. Ask the patient if they would like to have other patients from the unit come and visit to help with their boredom and anxiety. Option B. Immediately retrieve a magazine for the patient to help alleviate their boredom and provide a distraction. Option C. Explain to the patient that their fears are unfounded and proceed with other scheduled patient care tasks. Option D. Ensure the room door is securely locked and then sit with the patient for a few minutes to discuss their fears before retrieving the magazine. Correct answer is D. Ensure the room door is securely locked and then sit with the patient for a few minutes to discuss their fears before retrieving the magazine. Explanation. Scenario analysis. This scenario presents a common challenge for licensed practical nurses, LPN, where a patient's immediate physiological needs may appear to overshadow their psychosocial or safety concerns. The challenge lies in prioritizing interventions when multiple needs are present, requiring the LPN to apply theoretical frameworks like Maslow's hierarchy of needs to make sound clinical judgments that promote holistic patient well-being. Correct approach analysis. Prioritizing the patient's need for a safe environment and addressing their expressed anxiety directly aligns with the foundational levels of Maslow's hierarchy. Safety needs, security, freedom from fear, are considered more fundamental than higher-level needs like belonging or esteem. By ensuring the room is secure and addressing the patient's fear, the LPN is establishing a stable base from which other needs can be met. This approach is ethically sound, adhering to the LPN's duty of care to ensure patient safety and provide comfort, which are core tenets of nursing practice and often reflected in state nurse practice acts and professional codes of ethics. Incorrect approaches analysis. Focusing solely on the patient's request for a magazine, while seemingly addressing a comfort need, neglects the more immediate safety and physiological concerns. This approach fails to recognize the hierarchy of needs, potentially leaving the patient vulnerable to their expressed fears and an unsafe environment. Ethically, this could be seen as a failure to adequately assess and intervene for patient safety, ignoring the patient's anxiety and proceeding with routine tasks without acknowledging their emotional state disregards the psychosocial aspect of care. This approach overlooks the importance of the patient feeling heard and secure, which can impact their overall recovery and willingness to engage in care. It may violate ethical principles of patient-centered care and respect for dignity. Attempting to immediately address a need for social interaction, such as inviting other patients to visit, without first ensuring the patient's safety and addressing their immediate anxiety, is premature. While social interaction is important, it falls higher on Maslow's hierarchy and cannot be effectively addressed if fundamental safety and security needs are unmet. This could lead to further distress if the patient feels overwhelmed or unsafe. Professional reasoning. Licensed practical nurses should utilize a systematic approach to patient care, beginning with a comprehensive assessment. When faced with multiple patient needs, applying Maslow's hierarchy of needs provides a framework for prioritization. The LPN should first identify and address the most basic physiological and safety needs before moving to higher-level psychosocial needs. This involves active listening, clear communication, and a commitment to patient advocacy, ensuring that interventions are both clinically appropriate and ethically grounded in the principles of beneficence and non-maleficence. Question 9. What factors determine the appropriate method for reprocessing a reusable surgical instrument to ensure its sterility or adequate disinfection for patient use? Option A. A general understanding of sterilization principles and the assumption that all reusable instruments follow a single, standardized reprocessing protocol. Option B. The visual appearance of the instrument after initial cleaning and the general practices observed among colleagues. Option C. The manufacturer's instructions for use (IFU) for the specific instrument, the healthcare facility's infection control policies and procedures, and the intended use of the instrument. Option D. The perceived level of contamination based on the type of procedure the instrument was used in and the availability of cleaning supplies. The correct answer is C. The manufacturer's instructions for use (IFU) for the specific instrument, the healthcare facility's infection control policies and procedures, and the intended use of the instrument. Explanation. This scenario is professionally challenging because the licensed practical nurse, LPN, must make a critical decision regarding the sterility of a reusable medical instrument without direct supervision and with potential patient safety implications. The LPN's judgment is paramount in ensuring that appropriate sterilization or disinfection techniques are applied to prevent healthcare-associated infections. The core of the challenge lies in understanding the nuances of different decontamination methods and their suitability for specific instruments and intended uses, adhering strictly to established protocols and regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient safety and adherence to regulatory standards. By consulting the manufacturer's instructions for use (IFU) and the facility's infection control policies, the LPN ensures that the chosen method is validated, effective, and compliant with established guidelines for sterilization and disinfection. This systematic approach minimizes the risk of microbial contamination and subsequent patient harm, upholding the ethical obligation to provide safe and competent care. An incorrect approach, such as relying solely on visual inspection, fails to recognize that many microorganisms are not visible to the naked eye. This can lead to the use of inadequate disinfection methods, posing a significant risk of transmitting infections. Another incorrect approach, assuming a standard protocol applies without verification, disregards the specific requirements of different instruments and the potential for variations in material composition or design that might necessitate specialized decontamination. This can result in ineffective sterilization or damage to the instrument. Relying on anecdotal evidence or the practice of colleagues without verifying against official guidelines is also a failure, as it bypasses established evidence-based practices and regulatory mandates, potentially leading to widespread breaches in infection control. The professional decision-making process for similar situations involves a hierarchical approach. First, always refer to the manufacturer's IFU for the specific device. Second, consult the healthcare facility's established infection control policies and procedures, which are typically based on regulatory guidelines. Third, if there is any ambiguity or if the IFU and facility policy are unclear or conflicting, seek clarification from a supervisor, infection control practitioner, or other designated expert. This structured approach ensures that decisions are evidence-based, compliant, and prioritize patient safety above all else. Question 10. When evaluating a patient who has suddenly become unresponsive and is not breathing normally, what is the immediate priority action for a licensed practical nurse trained in basic life support? Option A. Attempt to locate a carotid pulse. Option B. Check the patient's pupils for dilation. Option C. Administer oxygen via a non-rebreather mask. Option D. Immediately begin high-quality chest compressions. The correct answer is D. Immediately begin high-quality chest compressions. Explanation. This scenario is professionally challenging because it requires immediate, decisive action in a high-stress situation where a patient's life is at risk. The licensed practical nurse, LPN, must quickly assess the situation, prioritize interventions based on established protocols, and communicate effectively, all while maintaining patient safety and adhering to professional standards of care. The core of the challenge lies in applying basic life support, BLS, principles accurately and efficiently under pressure. The correct approach represents best professional practice because it directly aligns with the fundamental principles of BLS as mandated by nursing practice acts and professional nursing organizations. These guidelines emphasize the immediate need for high-quality chest compressions and prompt defibrillation if indicated, as these are the most critical interventions for restoring circulation and improving survival rates in cardiac arrest. Adhering to these protocols ensures that the LPN is providing evidence-based care that maximizes the patient's chance of recovery. An incorrect approach that involves delaying chest compressions to search for a pulse or administer medications without confirming cardiac rhythm would be a significant regulatory and ethical failure. Delaying compressions directly contradicts BLS guidelines, which prioritize uninterrupted chest compressions. Failure to follow established BLS protocols constitutes a breach of the standard of care, potentially leading to irreversible patient harm and violating the nurse's ethical duty to act in the patient's best interest. Furthermore, administering medications without a proper rhythm assessment is inappropriate and can be harmful. Another incorrect approach, such as focusing solely on airway management without initiating chest compressions, fails to address the most immediate life-threatening issue in cardiac arrest: the absence of effective circulation. While airway and breathing are crucial, they are secondary to circulation in the initial moments of resuscitation. This deviation from BLS priorities demonstrates a lack of understanding of the critical sequence of interventions and a failure to adhere to established emergency protocols. The professional decision-making process for similar situations should involve a rapid assessment of the patient's responsiveness and breathing. If the patient is unresponsive and not breathing normally, the LPN should immediately activate the emergency response system, begin high-quality chest compressions, and prepare for defibrillation if an automated external defibrillator (ED) is available. Continuous reassessment and clear communication with the healthcare team are paramount throughout the resuscitation effort. This systematic approach ensures that the most critical interventions are performed without delay, adhering to established BLS guidelines and ethical obligations. Question 11. Stakeholder feedback indicates a recurring concern regarding the timely and appropriate management of patient discomfort. A licensed practical nurse, LPN, is caring for a patient who reports experiencing moderate post-operative pain, stating, "It's really starting to hurt and I can't get comfortable." The LPN has reviewed the patient's chart and notes that the last pain medication was administered 4 hours ago, and the physician's orders allow for pain medication every 4 to 6 hours as needed. The LPN also observes that the patient is due for a routine vital signs check in 30 minutes. What is the most appropriate course of action for the LPN? Option A. Inform the patient that pain medication can only be given at scheduled times and suggest they try to relax until their vital signs are taken. Option B. Administer the prescribed pain medication as ordered, after assessing the patient's pain level and confirming it is time for the next dose. Option C. Proceed with taking the patient's vital signs as scheduled and then address the pain medication request. Option D. Administer a dose of pain medication immediately, even though it has only been 3 hours since the last dose, to ensure the patient's comfort. The correct answer is B. Administer the prescribed pain medication as ordered, after assessing the patient's pain level and confirming it is time for the next dose. Explanation: this scenario is professionally challenging because it requires the licensed practical nurse, LPN, to balance immediate patient needs with established protocols and the scope of practice, all while ensuring patient safety and dignity. The LPN must accurately assess the situation, prioritize interventions based on physiological needs, and communicate effectively with the healthcare team. Careful judgment is required to avoid overstepping boundaries or neglecting critical care. The correct approach represents best professional practice because it directly addresses the patient's most urgent physiological need, pain relief, in a timely and appropriate manner, aligning with the LPN scope of practice and the principles of patient-centered care. This approach prioritizes comfort and well-being, which are fundamental aspects of nursing care. It also involves appropriate delegation and communication, ensuring continuity of care and adherence to physicians' orders. An incorrect approach that involves delaying pain management due to a perceived minor issue fails to recognize the physiological impact of pain and its potential to exacerbate other conditions or impede recovery. This neglects the LPN's ethical and professional responsibility to alleviate suffering. Another incorrect approach that involves administering medication without a physician's order or proper assessment constitutes a significant regulatory and ethical failure. This violates the Nurse Practice Act, which defines the scope of practice for LPNs, and could lead to patient harm and legal repercussions. It demonstrates a lack of understanding of medication administration protocols and patient safety. A third incorrect approach that involves ignoring the patient's request and focusing solely on routine tasks disregards the patient's expressed needs and the importance of individualized care. This can erode patient trust and negatively impact the therapeutic relationship, failing to uphold the ethical principle of beneficence. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's immediate needs, prioritizing physiological requirements. 2. Consult the patient's care plan and physician's orders. 3. Determine if the intervention falls within the LPN's scope of practice. 4. If necessary, communicate with the registered nurse or physician for clarification or further orders. 5. Implement the appropriate intervention safely and effectively, documenting all actions. 6. Continuously reevaluate the patient's response to care. Question 12. The efficiency study reveals that the nursing unit is experiencing increased patient load, leading to time pressures for the licensed practical nurse. During a busy shift, the LPN is caring for multiple patients and performing various tasks. Which of the following actions best demonstrates adherence to essential hand hygiene practices in this demanding environment? Option A. Performing hand hygiene only at the beginning and end of the nursing shift, regardless of patient interactions throughout the day. Option B. Relying solely on hand sanitizer for hand hygiene, even when hands are visibly soiled with bodily fluids. Option C. Skipping hand hygiene when hands do not appear visibly soiled, assuming they are clean enough for subsequent patient interactions. Option D. Performing hand hygiene with soap and water or an alcohol-based hand rub before and after direct patient contact, and after contact with the patient's immediate environment. Correct answer is D. Performing hand hygiene with soap and water or an alcohol-based hand rub before and after direct patient contact, and after contact with the patient's immediate environment. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where a licensed practical nurse, LPN, must balance efficiency with patient safety and infection control protocols. The pressure to complete tasks quickly, especially during busy shifts, can create a temptation to bypass crucial steps like proper hand hygiene. The LPN's responsibility extends beyond direct patient care to maintaining a safe environment, and hand hygiene is a cornerstone of preventing healthcare-associated infections. Correct approach analysis. The correct approach, which involves performing hand hygiene before and after patient contact, and after contact with the patient's environment, aligns directly with established infection control guidelines and nursing practice standards. This practice is mandated by regulatory bodies like the Centers for Disease Control and Prevention, CDC, and is a fundamental ethical obligation of all healthcare professionals to protect patients from harm. Adhering to these protocols minimizes the transmission of pathogens, thereby safeguarding patient well-being and contributing to a safer healthcare system. Incorrect approaches analysis. One incorrect approach involves skipping hand hygiene when the hands do not appear visibly soiled. This is a significant regulatory and ethical failure. While hands may not look dirty, they can still harbor microorganisms that can be transmitted to patients. Regulatory guidelines universally emphasize that visible soiling is not the sole indicator for hand hygiene. It is a necessary practice after every patient interaction and contact with potentially contaminated surfaces. This approach demonstrates a disregard for established infection control principles and increases the risk of HAIs. Another incorrect approach is to only perform hand hygiene at the beginning of the shift and at the end of the day. This is a critical failure to adhere to infection control protocols. Hand hygiene is a moment-specific intervention. Performing it only at the start and end of a shift leaves numerous opportunities for pathogen transmission between patients, from the environment to patients, and from patients to the nurse, and then to other patients. This practice is a direct violation of best practices and regulatory requirements designed to prevent the spread of infection. A third incorrect approach is to rely solely on hand sanitizer when hands are visibly soiled. This is a dangerous misconception and a violation of hand hygiene guidelines. While alcohol-based hand sanitizers are effective for reducing the number of microbes on hands when they are not visibly soiled, they are not a substitute for washing hands with soap and water when hands are visibly dirty or contaminated with bodily fluids. This approach fails to remove organic material and certain types of pathogens effectively, posing a significant risk of infection transmission. Professional reasoning. When faced with time constraints, a licensed practical nurse should prioritize patient safety and infection control above all else. The decision-making process should involve recognizing that hand hygiene is a non-negotiable component of patient care. If time is a genuine concern, the nurse should advocate for adequate staffing or explore ways to streamline other non-critical tasks, rather than compromising on fundamental safety practices. The nurse should always refer to facility policies and procedures, which are typically based on national guidelines, to ensure compliance. Ethical principles of beneficence, doing good, and non-maleficence, avoiding harm, strongly dictate the consistent and correct performance of hand hygiene. Question 13. The performance metrics show a consistent decline in patient satisfaction scores related to emotional support and communication for a specific unit. As a licensed practical nurse, you observe that many patients express feelings of loneliness and a lack of connection. Which of the following actions best addresses the patient's love and belonging needs within your scope of practice? Option A. Focus solely on completing physical assessments and medication administration, assuming that emotional needs are outside the LPN's direct responsibility. Option B. Inform patients that their families are responsible for providing emotional support and that the nursing staff's primary role is clinical care. Option C. Suggests that patients engage in solitary activities like reading or watching television to occupy their time and distract them from feelings of loneliness. Option D. Dedicate time each shift to sit with patients, actively listen to their concerns, and encourage them to share their feelings and experiences. The correct answer is D. Dedicate time each shift to sit with patients, actively listen to their concerns, and encourage them to share their feelings and experiences. Explanation. The performance metrics show a consistent decline in patient satisfaction scores related to emotional support and communication for a specific unit. This scenario is professionally challenging because it directly impacts the quality of care beyond purely clinical outcomes, touching upon the fundamental human need for love and belonging. Licensed practical nurses, LPN, are tasked with providing holistic care, which includes addressing patients' psychosocial needs. Failing to do so not only diminishes the patient experience, but can also negatively affect their recovery and overall well-being. The challenge lies in balancing time constraints, competing demands, and the inherent emotional labor required to foster a sense of connection and belonging. The correct approach involves actively listening to patient concerns, validating their feelings, and making a conscious effort to create opportunities for social interaction and emotional expression. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy, acknowledging the patient's right to be treated with dignity and compassion. Regulatory frameworks for LPNs emphasize patient-centered care and the importance of establishing therapeutic relationships. By prioritizing these aspects, the LPN demonstrates a commitment to meeting the patient's love and belonging needs, which is integral to their role in promoting healing and comfort. An incorrect approach would be to dismiss patient complaints about feeling lonely or unheard as simply part of being in a healthcare setting. This fails to recognize the profound impact of social isolation on health and violates the ethical duty to provide compassionate care. It also disregards the regulatory expectation that LPNs should advocate for their patients' holistic needs. Another incorrect approach is to delegate all emotional support tasks solely to family members, neglecting the LPN's own responsibility to provide comfort and connection, especially when family presence is limited or absent. This overlooks the therapeutic role the LPN plays in the patient's recovery journey and can lead to feelings of abandonment. A third incorrect approach is to focus exclusively on physical tasks and clinical assessments, viewing emotional needs as secondary or outside the scope of LPN practice. This is a fundamental misunderstanding of the LPN's role, which encompasses the provision of basic human care, including emotional support, as outlined in nursing practice acts and ethical codes. Professional decision-making in such situations requires a systematic approach. First, acknowledge the data from performance metrics as a valid indicator of care quality. Second, assess the specific patient needs related to love and belonging, considering individual preferences and cultural backgrounds. Third, implement interventions that foster connection, such as encouraging family visits, facilitating communication with loved ones, providing opportunities for social engagement within the unit, and simply offering a listening ear and empathetic presence. Finally, document these efforts and reassess their impact on patient satisfaction and well-being, adjusting the care plan as needed. Question 14. The audit findings indicate a pattern of blood pressure readings being documented by a physician that are consistently higher than those initially taken by licensed practical nurses on the same patients. During your shift, you take a patient's blood pressure and obtain a reading of 110/70 mmHg. The physician subsequently documents a reading of 140/90 mmHg for the same patient without remeasuring. What is the most appropriate course of action for the licensed practical nurse? Option A. Document your reading but do not mention the discrepancy to the physician, assuming the physician has a valid reason for the difference. Option B. Remeasure the patient's blood pressure yourself, document your findings accurately, and then professionally communicate the discrepancy to the physician, presenting your verified reading. Option C. Accept the physician's documented blood pressure reading as accurate and proceed with patient care as ordered. Option D. Immediately confront the physician about the discrepancy in readings. The correct answer is B. Remeasure the patient's blood pressure yourself, document your findings accurately, and then professionally communicate the discrepancy to the physician, presenting your verified reading. Explanation. This scenario presents a professional challenge because it involves a conflict between a physician's directive and the licensed practical nurses, LPN, professional judgment regarding patient safety and accurate data collection. The LPN is responsible for ensuring that patient care is delivered according to established standards and that the data collected is reliable for effective treatment. The audit findings highlight a potential systemic issue or individual lapse that could compromise patient care. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established nursing standards. By taking the initiative to remeasure the blood pressure and document the discrepancy, the LPN is acting as a patient advocate and ensuring the accuracy of vital signs. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it upholds the LPN's professional responsibility to report significant findings and deviations from expected norms, which is crucial for accurate diagnosis and treatment planning. This action also reflects adherence to the Nurse Practice Act and facility policies that mandate accurate data collection and reporting. An incorrect approach of simply accepting the physician's initial reading without verification would be a regulatory and ethical failure. It demonstrates a lack of critical thinking and a failure to advocate for the patient. This could lead to misdiagnosis or inappropriate treatment based on inaccurate vital signs, violating the principle of non-maleficence. Also fails to uphold the LPN's duty to report and document accurately, potentially leading to a breach of professional standards and accountability. Another incorrect approach of immediately confronting the physician without first verifying the reading would be premature and could create unnecessary conflict. While communication is vital, it should be based on accurate information. This approach bypasses the essential step of ensuring the LPN's own data is correct, potentially leading to an unproductive or adversarial interaction. A third incorrect approach of ignoring the discrepancy and proceeding with the physician's documented reading is a direct violation of professional responsibility. It signifies a failure to exercise independent judgment and a disregard for the accuracy of patient data, which is fundamental to safe nursing practice. This could have serious consequences for the patient's health and would be a clear breach of nursing standards and ethical obligations. The professional decision-making process for similar situations involves a systematic approach. 1. Assess the situation and identify the discrepancy. 2. Verify the data through remeasurement or other appropriate means. 3. Document findings accurately, including any discrepancies. 4. Communicate findings to the appropriate healthcare provider, in this case the physician, in a clear and professional manner, presenting the verified data. 5. Follow up as necessary to ensure appropriate action is taken. This process ensures patient safety, promotes accurate care, and upholds professional accountability. Question 15. Strategic planning requires a licensed practical nurse to anticipate potential infectious disease exposures and implement appropriate preventative measures. When caring for a patient presenting with symptoms suggestive of a highly contagious respiratory illness, which of the following actions demonstrates the most effective risk assessment and infection control strategy? Option A. Administer over-the-counter cough suppressants to manage the patient's symptoms while continuing routine care. Option B. Apply standard precautions to all patients in the unit as a general preventative measure. Option C. Observe the patient for a few days to see if symptoms resolve on their own before considering isolation. Option D. Immediately initiate airborne precautions for the patient and notify the charge nurse and infection control department. The correct answer is D. Immediately initiate airborne precautions for the patient and notify the charge nurse and infection control department. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed practical nurse, LPN, to balance immediate patient needs with the broader responsibility of preventing the spread of infection within a healthcare setting. The LPN must critically assess a situation involving a patient with a known, potentially transmissible condition, and determine the most effective and compliant course of action to protect both the patient and others. This involves understanding the specific transmission routes of the pathogen and applying appropriate infection control principles, which are heavily regulated. Correct approach analysis. The correct approach involves a systematic risk assessment that prioritizes patient safety and adherence to established infection control protocols. This aligns with the core ethical and regulatory responsibilities of an LPN, which include preventing harm and maintaining a safe environment. Specifically, it requires identifying the pathogen, understanding its mode of transmission, and implementing evidence-based precautions. This proactive and informed approach minimizes the risk of healthcare-associated infections, and ensures compliance with state nursing practice acts and facility policies, which mandate adherence to infection control standards. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms as minor or unrelated to infection without proper assessment. This fails to meet the LPN's duty of care and could lead to the undetected spread of a contagious illness, violating regulations that require nurses to identify and report potential health hazards. Another incorrect approach would be to implement universal precautions for all patients regardless of their condition. While universal precautions are a foundational element of infection control, a targeted risk assessment allows for the most efficient and effective application of specific isolation precautions when indicated, preventing unnecessary resource strain and patient discomfort. Failing to tailor precautions based on a specific risk assessment can be seen as a failure to apply professional judgment as mandated by nursing practice standards. A third incorrect approach would be to rely solely on anecdotal evidence or personal experience without consulting current guidelines or protocols. This disregards the importance of evidence-based practice and regulatory mandates for infection control, potentially leading to outdated or ineffective practices that compromise patient safety and violate professional standards. Professional reasoning. Professionals should employ a decision-making framework that begins with recognizing potential risks, followed by gathering relevant information, patient history, symptoms, diagnostic data, consulting established protocols and guidelines, facility policies, CDC recommendations, implementing appropriate interventions, and continuously evaluating the effectiveness of those interventions. This systematic process ensures that decisions are informed, evidence-based, and compliant with regulatory requirements. Question 16. The monitoring system demonstrates that Mrs. Gable, a 78-year-old patient recovering from a hip replacement, has consistently expressed feelings of boredom and a desire to contribute to something meaningful, even while adhering to her physical therapy regimen. She has mentioned missing her volunteer work at the local library and her gardening. As a licensed practical nurse, how should you best address these expressed needs within the scope of your practice? Option A. Inform Mrs. Gable that her desire to volunteer or garden is not relevant to her current medical situation and that she should focus solely on her physical rehabilitation. Option B. Focus exclusively on ensuring Mrs. Gable is comfortable and compliant with her physical therapy exercises, as these are the primary factors for her recovery. Option C. Arrange for other patients to visit Mrs. Gable to provide social interaction, assuming this will fulfill her need for meaningful engagement. Option D. Explore opportunities for Mrs. Gable to engage in modified versions of her previous volunteer activities or gardening within the facility or her home environment, in consultation with her physical therapist and physician, to foster a sense of purpose and accomplishment. The correct answer is D. Explore opportunities for Mrs. Gable to engage in modified versions of her previous volunteer activities or gardening within the facility or her home environment, in consultation with her physical therapist and physician, to foster a sense of purpose and accomplishment. Explanation: this scenario is professionally challenging because it requires the licensed practical nurse (LPN) to balance the immediate needs of a patient with their long-term psychological well-being, specifically addressing self-actualization needs within the scope of LPN practice. The LPN must recognize that patient care extends beyond basic physiological needs to encompass opportunities for personal growth and fulfillment, even within a healthcare setting. The correct approach represents best professional practice because it aligns with the ethical principles of patient-centered care and promotes holistic well-being. By actively seeking opportunities for the patient to engage in activities that foster a sense of purpose and accomplishment, the LPN is supporting the patient's journey towards self-actualization. This proactive engagement demonstrates a commitment to the patient's overall quality of life and respects their inherent dignity and potential, which is a core tenet of nursing practice as outlined by the specified relevant nursing regulatory body, e.g., National Council of State Boards of Nursing, NCSBN, for U.S.-based LPN exams, or relevant UK NMC standards if applicable. This approach acknowledges that a patient's recovery and well-being are influenced by their psychological and emotional state, and that fostering these aspects can contribute to better health outcomes. An incorrect approach that focuses solely on the patient's physical condition and immediate comfort, while important, fails to address the higher-level needs of self-actualization. This oversight can lead to a patient feeling a lack of purpose or fulfillment during their recovery, potentially hindering their overall engagement and motivation. Ethically, this approach may be seen as providing adequate but not optimal care, potentially violating the principle of beneficence by not maximizing the patient's potential for well-being. Another incorrect approach that involves making decisions about the patient's personal growth without their direct input or consent is a significant ethical and regulatory failure. This infringes upon the patient's autonomy and right to self-determination. The LPN's role is to facilitate, not dictate, the patient's pursuit of self-actualization. Such an approach could lead to resentment, distrust, and a feeling of disempowerment for the patient, directly contradicting the principles of patient advocacy and respect for individual rights. A further incorrect approach that dismisses the patient's expressed desire for personal growth as irrelevant to their medical condition demonstrates a narrow and incomplete understanding of patient care. This can lead to a patient feeling unheard and devalued, negatively impacting their morale and potentially their willingness to participate in their care. It fails to recognize the interconnectedness of physical, mental, and emotional health, and the role that psychological well-being plays in overall recovery and life satisfaction. The professional decision-making process for similar situations involves a thorough assessment of the patient's holistic needs, including their psychological and emotional state, in addition to their physical condition. It requires active listening to the patient's expressed desires and goals, and then, within the scope of LPN practice and in collaboration with the healthcare team, identifying and facilitating opportunities that support their pursuit of self-actualization. This involves advocating for the patient, respecting their autonomy, and ensuring that care is individualized and promotes their overall well-being and potential. Question 17. The assessment process reveals a patient experiencing sudden onset dyspnea and audible wheezing upon exhalation. Which of the following physical assessment techniques is most crucial for the licensed practical nurse to perform immediately to gather objective data about the patient's respiratory status? Option A, palpating the chest for tactile fremitus. Option B, observing the patient's skin turgor. Option C, percussing the chest for areas of dullness or hyperresonance. Option D, auscultating the lung fields for adventitious sounds. Correct answer is A, palpating the chest for tactile fremitus. Explanation: the assessment process reveals a patient experiencing dyspnea and chest tightness. This scenario is professionally challenging because it requires the licensed practical nurse, LPN, to quickly and accurately assess the patient's respiratory status, differentiate between potential causes, and initiate appropriate interventions within their scope of practice. The LPN must rely on their foundational knowledge of physical assessment techniques to gather objective data that will guide their actions and communication with the supervising registered nurse or physician. Careful judgment is required to prioritize interventions and ensure patient safety. The correct approach represents best professional practice because it systematically utilizes established physical assessment techniques to gather comprehensive data. Palpation of the chest for tactile fremitus, auscultation of lung sounds for adventitious sounds like crackles or wheezes, and observation of respiratory rate and effort are all core components of a respiratory assessment. This thoroughness ensures that the LPN is not missing critical signs and symptoms, allowing for a more accurate understanding of the patient's condition. Adhering to these techniques aligns with the nursing practice standards and guidelines that mandate a comprehensive and systematic approach to patient assessment, ensuring that care is evidence-based and patient-centered. This approach facilitates effective communication with the healthcare team, enabling timely and appropriate medical management. An incorrect approach that involves solely relying on the patient's subjective report of feeling short of breath, without performing objective physical assessments, is professionally unacceptable. This failure to perform objective data collection violates the regulatory framework that requires LPNs to conduct assessments to identify patient needs and potential health problems. It also represents an ethical failure to provide competent care, as subjective reports alone are insufficient for diagnosis or treatment planning. Another incorrect approach that focuses only on checking vital signs like pulse and blood pressure, while important, neglects the specific assessment of the respiratory system. This omission is a regulatory failure as it does not fulfill the requirement to assess the presenting problem comprehensively. Ethically, it demonstrates a lack of diligence in identifying the root cause of the patient's distress, potentially delaying necessary respiratory interventions. A third incorrect approach that involves administering a prescribed bronchodilator without first assessing the patient's lung sounds and respiratory effort is also professionally unacceptable. This bypasses the essential assessment phase, which is a regulatory requirement for safe medication administration. Ethically, it is a failure to practice prudently, as the medication may not be indicated or could even be contraindicated without a proper assessment of the patient's current respiratory status. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the presenting problem and its potential seriousness. 2. Recall and apply appropriate physical assessment techniques relevant to the presenting problem. 3. Gather objective data through these techniques. 4. Analyze the collected data in conjunction with subjective reports. 5. Communicate findings and concerns to the appropriate healthcare provider. 6. Implement interventions within the LPN scope of practice and as directed by the healthcare team. This structured approach ensures that patient care is safe, effective, and compliant with professional standards. Question 18. Process analysis reveals a licensed practical nurse, LPN, is caring for a patient with a chronic non-healing wound. The patient expresses a strong preference for a specific over-the-counter topical agent they have used in the past, stating it always works. The LPN notes the wound shows signs of increased redness and warmth, and the patient has a history of poor adherence to prescribed wound care regimens. What is the most appropriate initial nursing action? Option A. Apply the patient's preferred over-the-counter topical agent immediately, as the patient states it has been effective in the past and their preference should be honored. Option B. Inform the patient that their preference cannot be accommodated due to the signs of infection and proceed with applying a broad-spectrum antibiotic ointment as per facility protocol for suspected infection. Option C. Assess the wound thoroughly, review the patient's medical history for factors influencing healing and infection risk, and consult with the registered nurse and healthcare provider to determine the most appropriate evidence-based wound care plan, incorporating patient preferences where safe and feasible. Option D. Document the patient's preference and the signs of increased redness and warmth, but proceed with the current prescribed wound care regimen without further immediate intervention, as the patient's history of non-adherence suggests their input may not be reliable. Correct answer is C. Assess the wound thoroughly, review the patient's medical history for factors influencing healing and infection risk, and consult with the registered nurse and healthcare provider to determine the most appropriate evidence-based wound care plan, incorporating patient preferences where safe and feasible. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient with a complex wound and a history of non-adherence, requiring the licensed practical nurse, LPN, to balance patient autonomy with the imperative of infection prevention. The LPN must assess the situation critically, considering the potential risks of infection, the patient's stated preferences, and the established standards of care for wound management. The challenge lies in navigating these competing factors to ensure the patient's safety and promote optimal healing, while respecting their right to participate in their care decisions. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based infection prevention protocols. By thoroughly assessing the wound, reviewing the patient's history, and consulting with the registered nurse, RN, and the healthcare provider, the LPN ensures that the most appropriate and effective wound care plan is implemented. This collaborative approach, grounded in the principles of infection control and patient advocacy, aligns with the LPN's scope of practice and regulatory requirements for providing safe and competent nursing care. It demonstrates adherence to the Nurse Practice Act and facility policies regarding wound management and infection prevention, ensuring that care is delivered according to established standards. Incorrect approaches analysis. One incorrect approach involves proceeding with the patient's requested treatment without further assessment or consultation. This fails to uphold the LPN's responsibility to assess the patient's condition and implement evidence-based interventions. It disregards the potential for the patient's request to be detrimental to their healing and increases the risk of infection, violating ethical principles of beneficence and non-maleficence, as well as regulatory mandates for safe nursing practice. Another incorrect approach is to dismiss the patient's concerns and unilaterally impose a treatment plan. This disrespects patient autonomy and the right to informed consent, potentially eroding the therapeutic relationship. While infection prevention is paramount, patient education and shared decision-making are crucial components of effective care. This approach could lead to patient dissatisfaction and non-adherence, ultimately hindering the healing process and violating ethical obligations to respect patient dignity and rights. A third incorrect approach is to delay care indefinitely due to the patient's history of non-adherence, without actively seeking solutions or escalating the concern. This inaction can lead to the deterioration of the wound and an increased risk of systemic infection. It fails to meet the nursing standard of care, which requires timely and appropriate interventions to address patient needs and prevent adverse outcomes. This passive approach neglects the LPN's duty to advocate for the patient and ensure their well-being. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the patient's condition and the wound status. This should be followed by a review of the patient's medical history, including any factors that may impact healing or increase infection risk. Next, the LPN should consider the established protocols and best practices for wound care and infection prevention. Crucially, open and respectful communication with the patient is essential to understand their perspective, concerns, and preferences. When there are discrepancies between the patient's wishes and the recommended course of action, or when the situation presents complexity, the LPN must collaborate with the registered nurse and the healthcare provider to develop a safe and effective care plan. This iterative process of assessment, communication, collaboration, and intervention ensures that patient care is individualized, evidence-based, and ethically sound. Question 19. Process analysis reveals a licensed practical nurse, LPN, is caring for a patient who has recently undergone a significant surgical procedure. The patient, previously engaged and communicative, has become withdrawn, refuses to participate in physical therapy, and expresses feelings of worthlessness. The LPN observes that the patient's hygiene has declined, and they are isolating themselves in their room. Considering the patient's esteem needs, which of the following actions by the LPN would best promote the patient's recovery and well-being? Option A. Insist that the patient participate in physical therapy as scheduled, explaining that it is crucial for their physical recovery and that their current feelings are temporary. Option B. Gently inquire about the patient's feelings and concerns regarding their recovery and self-perception, validating their emotions and offering support to re-engage in therapy at their own pace. Option C. Document the patient's refusal of therapy and decline in hygiene, informing the physician of the change in behavior without further direct intervention. Option D. Focus solely on administering prescribed medications and monitoring vital signs, as these are the primary responsibilities of the LPN in this situation. The correct answer is B. Gently inquire about the patient's feelings and concerns regarding their recovery and self-perception, validating their emotions and offering support to re-engage in therapy at their own pace. Explanation. This scenario is professionally challenging because it requires the licensed practical nurse, LPN, to balance patient autonomy with the need for therapeutic intervention, specifically addressing the patient's esteem needs. The patient's withdrawal and refusal to participate in care directly impact their self-worth and ability to engage in recovery. The LPN must recognize that esteem needs, as described by Maslow's hierarchy of needs, are crucial for overall well-being and can significantly influence a patient's response to treatment. The correct approach represents best professional practice because it prioritizes a patient-centered, holistic care model. By actively seeking to understand the underlying reasons for the patient's withdrawal and validating their feelings, the LPN demonstrates empathy and respect. This fosters trust and encourages the patient to re-engage, which is essential for effective care delivery and promoting their sense of self-worth. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy, as well as regulatory guidelines that mandate compassionate and individualized patient care. An incorrect approach that involves simply documenting the patient's refusal without further investigation or intervention fails to address the patient's esteem needs. This could be considered a breach of professional duty to provide comprehensive care and may violate regulations requiring proactive patient assessment and engagement. Another incorrect approach, such as forcing the patient to participate in activities against their will, disregards their autonomy and can further damage their self-esteem, leading to increased resistance and potentially violating patient rights. A third incorrect approach, focusing solely on the physical aspects of care while ignoring the psychological impact, demonstrates a lack of holistic understanding and may not meet the standards of care expected of an LPN. Professionals should use a decision-making framework that begins with thorough patient assessment, including identifying unmet needs at various levels of Maslow's hierarchy. This should be followed by open communication, active listening, and collaborative goal setting with the patient. When faced with resistance, the professional should explore underlying causes, validate feelings, and adapt the care plan accordingly, always prioritizing patient dignity and well-being within the scope of practice and regulatory guidelines. Question 20. Operational review demonstrates that a licensed practical nurse LPN is caring for a patient who presents with sudden onset of shortness of breath, increased heart rate, and a complaint of chest tightness. The LPN has assessed the patient's vital signs and observed the patient's distress. Within the scope of practice for a licensed practical nurse, what is the most appropriate next step? Option A. Report the patient's signs, symptoms, and vital signs to the registered nurse or physician immediately. Option B. Document the patient's symptoms as likely anxiety and monitor from a distance. Option C. Advise the patient to take slow, deep breaths and reassure them that it will pass. Option D. Administer a prescribed bronchodilator based on the assumption of an asthma exacerbation. The correct answer is A. Report the patient's signs, symptoms, and vital signs to the registered nurse or physician immediately. Explanation. Scenario analysis. This scenario presents a professional challenge because the licensed practical nurse, LPN, is faced with a patient exhibiting symptoms that could indicate multiple potential diagnoses. The LPN's role is to observe, report, and provide basic care, but not to independently diagnose. Misinterpreting or overstepping the scope of practice in diagnosing can lead to incorrect treatment, patient harm, and regulatory violations. The challenge lies in accurately assessing the situation within the defined scope of practice and ensuring appropriate medical professionals are involved. Correct approach analysis. The correct approach involves the LPN recognizing the limitations of their diagnostic scope by gathering objective data, observing the patient's signs and symptoms, and then communicating these findings clearly and concisely to the registered nurse, RN, or physician. The LPN fulfills their professional responsibility. This aligns with the regulatory framework for LPNs, which emphasizes collaboration and reporting to higher-level practitioners for definitive diagnosis and treatment planning. This ensures patient safety and adherence to legal and ethical standards of care. Incorrect approaches analysis. One incorrect approach would be for the LPN to independently conclude a specific diagnosis based on the observed symptoms. This is a direct violation of the LPN scope of practice, which does not permit independent diagnosis. Such an action could lead to inappropriate interventions, delayed or incorrect medical management, and potential harm to the patient. Ethically, it breaches the duty of care by acting outside of established professional boundaries. Another incorrect approach would be for the LPN to dismiss the symptoms as minor or unrelated to a significant issue without further assessment or reporting. This failure to recognize and report potentially serious signs and symptoms constitutes negligence. It violates the ethical principle of beneficence, acting in the patient's best interest, and could lead to a worsening of the patient's condition due to delayed medical attention. A third incorrect approach would be to document a diagnosis in the patient's chart without it being confirmed by a physician or advanced practice provider. This misrepresents the patient's medical status and can lead to confusion in care planning and treatment. It is a breach of professional documentation standards and can have legal ramifications. Professional reasoning. When faced with a patient exhibiting new or changing symptoms, the professional decision-making process for an LPN should follow these steps. 1. Assess the patient's current condition, gathering objective data, vital signs, observations of appearance. Patient statements. 2. Identify the signs and symptoms present. 3. Recognize the limitations of the LPN scope of practice regarding diagnosis. 4. Report the assessment findings and observed symptoms to the appropriate healthcare provider, RN, physician, advanced practice provider, in a timely and accurate manner. 5. Document the observations and the report made. This systematic approach ensures patient safety, adherence to regulations, and effective interdisciplinary collaboration.